Hello, it's Dr. Gaeta again from the Gaeta Institute for Holistic Health Education. I wanted to share with you just a few words about why I have focused so much of my attention and study on and in practice over the last 30 years on autoimmune conditions. And the reason is that all disease eventually becomes autoimmune. So, and the reason for this is that all chronic illness, doesn't matter if it's cardiovascular disease, cancer, diabetes, Alzheimer's disease, whatever, is degenerative, meaning cells and tissues are breaking down too much. It was a degenerative process. All chronic disease is also inflammatory, which is related to that degeneration. And when we have too much burden of decaying, damaged, or dead cells, prematurely so, dying too soon, or becoming damaged or injured, the debris that the immune system and the lymphatic system must use to clean that up can eventually overwhelm that lymphatic or immune system from cleaning up all that cellular debris. And this can lead to the leakage of these cellular proteins and cellular components out of the lymphatic system, where it should stay contained and eliminated, and actually get into the bloodstream. And this is not good. We do not ever want to see necrotic debris of dead or damaged cells in the bloodstream. That's ideally not where they would be. This can lead to an autoimmune response to clean up all that cellular debris. And the body will generate autoantibodies or natural tissue antibodies to clean up that cellular debris. And this increase in autoantibodies due to the necrosis or premature cell death or cell damage then leads to an autoimmune condition where there's excess autoantibodies to body tissues, and those autoantibodies will then attack the body cells, the healthy body cells. So autoimmunity is a natural, normal thing in the body for there to be low levels of autoantibodies in the blood to various body tissues. That's normal, it's fine. But when it becomes excessive, that's where we have what we refer to as autoimmune disease. So for example, you'll see thyroid antibodies, for example, like thyroid peroxidase or thyroid globulin antibodies. There'll be an upper limit on the blood test of between 9 and 15 on the blood test, acknowledging the fact that low levels of these autoantibodies are normal, natural, and healthy, keeping the blood free of the nucleoproteins that make up those cells, the nuclear material, genetic material of those cells. So this is why I have focused so much on autoimmune disease over the years, is because everything eventually becomes autoimmune. Eventually we'll identify an autoimmune disease for every cell type in the body. And also that autoimmunity is not a primary cause of disease. It's rather a late stage consequence of chronic degeneration or inflammation in that tissue type in many cases, or that cell type or organ in many cases. So for all those reasons, I've really paid a lot of attention to this. And also because autoimmune disease is highly preventable. And in the holistic paradigm of holistic healthcare, one of our primary principles is that it's better to prevent than treat. And so preventing an autoimmune disease is a whole lot easier than treating a patient who has an autoimmune disease. So prevention is always key, and it's not that difficult to do. But that's why I put so much attention on this for all of these reasons. So it's very important that each of us become, as I have and many of my students have, an autoimmune proficient practitioner. That's the goal. You really can't help today's patient with all the autoimmune disease and people on the autoimmune continuum. You really can't help today's patient thoroughly, completely, without becoming somewhat proficient in autoimmune disease. So to learn more, please visit us at autoimmunemasteryprogram.com, autoimmunemasteryprogram.com, or through the main page for the Gaeta Institute for Holistic Health Education, which is michaelgaeta.com. Hope this has been useful for you, and thanks for listening today. Be well.